Bismillahirrahmanirrahim. Assalamu alaikum dear students. Welcome back to your channel The Anatomy Canvas. Today we are going to discuss with the histology of the gastrointestinal system. And digestive system consists of the alimentary canal and its associated organs, namely the tongue, teeth, salivary glands, pancreas, liver and the gallbladder. So oral cavity is a characteristic anatomical structure. Present in oral cavity are the lips, teeth, tongue and the salivary glands. So this is the diagram of the oral cavity. You can see the lips are present, the teeth and the tongue is present, the lingual papilla, the hard and the soft palate is present, and again the lip, this is the vestibule, and this is the oral cavity proper. So oral cavity is divided into vestibule and oral cavity proper. The oral cavity proper is the part which is covered on each side by the teeth, and on the superior side by the hard and soft palate, and on inferior side by the tongue. And the vestibule is the area of the oral cavity which is present in between the teeth and lips and the cheeks. So mucosa of the oral cavity, it is partly the masticatory mucosa, somewhere it is the lining mucosa, and sometimes it is the specialized mucosa. So what is the masticatory mucosa? The masticatory mucosa is found on the gingiva and the hard palate. It consists of the keratinized or parakeratinized epithelium and the lamina propria directly blending to the periosteum, and the submucosa which is present only on the hard palate. So what is the difference between keratinized and parakeratinized epithelium is that parakeratinized differ from keratinized in a sense that the stratum corneum do not lose their nuclei, and they does not stain strongly with eosine as compared to the keratinized. They do not stain strongly with the eosine. Beneath this epithelium there is lamina propria, which is a loose connective tissue, and it directly blends to the periosteum of the bone which is present in the area of the hard palate or the gingiva. The submucosa is only present in hard palate, and at places where it is present in hard palate posteriorly, it contains the either the adipose tissue or the mucus type of the glands in the submucosa. So this is H&E stain section of the gingiva. You can see this is the parakeratinized epithelium, stratified squamous non-keratinized type of epithelium. The surface cells are squamous in shape and they do not lose their nuclei. Another important thing you can appreciate in this diagram that the lamina propria is thrown into tall papilla, and a number of papilla is also increased. These increase in number of the papilla, and the tall papilla help the overlying epithelium to be injured during the shearing forces of the mastication or swallowing or speaking, etc. So the tall papilla and large number of the papilla help the mucosa to be help mucosa from injury. Beneath this epithelium is another reticular layer of the connective tissue, which is a dense connective tissue. Another slide of the gingiva. In this slide you can see the parakeratinized epithelium. Again you can appreciate the surface cells are squamous in shape and they are having their nucleus. Another thing you can appreciate is large number of the papilla present in the papillary layer of the connective tissue, and these papilla are tall. Beneath epithelium is the loose connective tissue. Another slide taken from the posterior part of the hard palate. You can appreciate the keratinized epithelium over here, stratified squamous keratinized epithelium. Beneath epithelium is the lamina propria, and then the mucosa which is having the large number of the tubulo-alveolar type of the gland which are mucous in nature. So this is submucosa, and this is the lamina propria, and this is the epithelium which is keratinized over here. You can see the keratin over here. You can also appreciate the keratin over here. Next is the lining mucosa. So the lining mucosa is found on the lips, the alveolar mucosal surfaces, floor of the mouth, inferior surface of the tongue and the soft palate. It is non-keratinized epithelium, and it consists of the three layers: the stratum basale, the stratum spinosum, and the stratum superficial. So you can see three types of layer. Three layers are present in this non-keratinized stratified squamous epithelium: the stratum basale, stratum spinosum, and the stratum superficial. All of the type of the cells, including the keratinocytes, Langerhans cells, melanocytes, Merkel cells, all of them are present in this type of epithelium. Also, the encapsulated sensory nerve endings are present in the papilla as well. Beneath the epithelium, there is the lamina propria, and then the distinct submucosa beneath lamina propria, which is present in lining epithelium except on inferior surface of the tongue. So this is the lining mucosa. This is the slide of the lip. You can appreciate the lip has basically three areas: the cutaneous area. This is the cutaneous area of the lip. You can appreciate that this is basically the true skin. Then the red area, this whole area is the red area of the skin. And then the oral surface or mucosal surface, which is facing the oral cavity. Another thing you can appreciate, this is the vermilion border. This is the junction between the red area and the cutaneous area. You can also see the cupid's bow over here. The philtral columns are present, and these are the oral commissures. Another thing you can appreciate in the with the naked eye is the Fordyce spots. These Fordyce spots are the sebaceous glands which are not associated with the hair follicle, present in the submucosa, and they are sometimes seen with the naked eye. These are called the Fordyce spots. So this is histological section of the slide of the lip. In this section you can appreciate this is the cutaneous area, also called the skin side. Epithelium over here is the stratified squamous keratinized type of epithelium, having the hair follicle in it, having sebaceous gland in it, and all the associated structure with the true skin are present over here. This area is the mucous side where the mucosa is present. This mucosa is stratified squamous non-keratinized type of epithelium, and beneath the mucosa there is the lamina propria and submucosa, and this is the junction area, also called the red area, and the junction of the red area and the skin side is the vermilion border. So you can appreciate the differences that over here on the skin side you can say this is purely true skin with associated all the structures of the skin, that is hair follicles, that is the sebaceous gland, that is sweat glands, etc. On the oral side you can see the mucous membrane is present, lined by stratified squamous non-keratinized type of epithelium, then lamina propria, then the submucosa having the glands. In the core of the lip is formed by the skeletal muscle, which is orbicularis oris, and the junction between two is the red area, and the red area the epithelium is non-keratinized, but thickness of epithelium is more as compared to that of the keratinized epithelium. Also another important point is that you will not see neither the structure associated with skin nor the structure associated with the mucous side. So this is the junctional area, the true skin, and the red area and the vermilion border. You can appreciate this is keratinized epithelium having hair follicle, having sebaceous glands with them, having the erector pylori muscles with them, all of the structures associated with true skin. This is the red area and the red area of the skin. You can see first the thickness of epithelium is more as compared to the true skin. Second important point is the surface cells having the keratohyalin granules in them, and these keratohyalin granules are refractile. Third important point is that there are the tall papillas. Papillary layer is thrown into tall papillas, and these papillas are highly vascular as well as contain large number of the nerves. So this vascularity is reflected through the surface because keratohyalin granules are refractile in nature. That's why we can see this area as a reddish area because of the refraction of the blood vessels which are present in these tall papilla. Again, another important point you can appreciate: neither the sebaceous glands or hair follicles or things associated with true skin are present over here, nor the mucous glands which are present in the mucous side of the lip. You cannot see these type of the glands over here. So this is the specialized type of the epithelium and the connective tissue. So this is the labeling the vermilion border, the skin side of the lip, and another slide which is H and E stain section on the oral side of the lip. You can see stratified squamous epithelium over here. You can see sagittal sections of the hair follicle, another hair follicle, another hair follicle, the sebaceous gland, the erector pylori muscles over here, again another section of the erector pylori muscle over here, and beneath this is the hypodermis, which containing the large number of the adipose tissue. Another slide which is taken from the mucous side of the lip. You can see the epithelium is stratified squamous but non-keratinized type of epithelium. Tall papilla are present over here, and beneath papilla lamina propria, and the submucosa is present, and this submucosa containing the mucus gland over here. Another very important point is large number of the elastic fibers are present in this tissue, which are running from the submucosa till the tips of the papilla, and these large number of papilla, tall papilla as well as elastic fibers help the overlying mucous membrane to prevent from the injuries during the mastication or swallowing or speaking, etc. So next, the third type of mucosa which is present in the oral cavity, this is the specialized mucosa. So up till now we have studied the lining mucosa and the masticatory mucosa. Third is the specialized mucosa. This specialized mucosa is restricted to the dorsal surface of the tongue. This is specialized mucosa, where this mucosa is thrown into special elevations called the papilla. So tongue is the muscular organ that is projecting into the oral cavity. Tongue is situated in the floor of the mouth and is attached by muscles to the hyoid bone, the mandible, the styloid process, and the pharynx. Tongue is important in taste and mastication, swallowing, and speech. It is composed chiefly of the skeletal muscles. It is partly covered by mucous membrane, and it presents a tip and the margins and the tarsal surface and the inferior surface and the root. Another important thing is that the median furrow is present, or median sulcus is present on the dorsal surface of the tongue. So oral part of dorsal surface show a shallow median groove. Intrinsic, intrinsics, both type of the skeletal muscles are present in the trunk. Anterior 2/3 of the trunk, and this is the V-shaped sulcus terminalis, and at the V-shaped sulcus terminalis you can appreciate the velate or circumvallate papilla are present over here. Then the palatoglossal arches are present. Here you can appreciate the foramen cecum, and then this is the lingual follicles, the palatine tonsils are present. So this whole is the dorsal surface, and underneath surface is called ventral or inferior surface. The elevations which are mucosal irregularities present on dorsal surface of the tongue is called the papilla. The surface of the tongue, you can see the schematic diagram of the tongue. Here you can see the filiform papilla present over here. Between the filiform papilla are the fungiform papilla over here. These filiform papilla has having the conical tips and they are keratinized. Here you can see the circumvallate papilla, the section of the circumvallate papilla. You can also appreciate the taste buds present over here. Beneath the papilla you can appreciate the von Ebner glandular glands which is opening into the trenches of the circumvallate papilla by the ducts. On posterior side you can appreciate the lingual tonsils are present, and this is a section of the lingual tonsils. Here you can appreciate the lymphoid follicles are present. This is the duct of the gland. This is another section taking through the taste buds. Usually three types of cells are present in the taste bud. These are the sustentacular cells, the neuroepithelial cells, and the basal cell. Here you can appreciate the taste pore. So sustentacular cells and neuroepithelial cells extend from the basal surface to the tip of the taste pore, and at the tip of the taste pore they are having the microvilli. Basal cells are present over here. They are short cells and they are considered as the stem cells. These sustentacular cells and neuroepithelial cells having the half-life of about 10 days. So we will study different types of papilla of the tongue one by one. The first are the filiform papilla. Mucosa has numerous minute lingual papillas. Filiform, they are narrowest and most numerous. This is another important MCQ. They are numerous, they are narrowest, they are present in the form of the rows. And nearly 10 to 5 to 30 tall secondary papillas. And very important point is that these papilla are the keratinized and they do not have the taste buds. So important point from MCQ's point of the view, that these are most numerous, they having the conical tips, they are the keratinized, and they do not have the taste buds with them. Another point to be remembered, that when there will be the keratin, the taste buds will not be present, and if the taste buds will be present, you cannot appreciate the keratin. So these two things will not be present with each other. Either the papilla will be keratinized, either it will be having the taste buds. So this one is the filiform papilla and this one is the fungiform papilla. This is the H&E stain section of the filiform papilla. You can see conical tips of the papilla which having the keratin over here, keratinized epithelium. So one is the keratin, two is showing the stratified squamous keratinized epithelium, 3 is the core of the papilla, and you can also appreciate the core may be branched as well in conical papillas. And beneath this you can appreciate the skeletal muscles are present. These are tongue muscles, and very important point for identification of the slide of the tongue. First, you can appreciate the specialized mucosa in the form of the papilla, and second very important point is in the core of the tongue you can appreciate the skeletal muscles, and these skeletal muscles are present in all the 3 directions. So these two very important points for identification of slide histologically on microscope. So the fungiform papilla. The fungiform papilla having the rounded heads and containing the taste buds. They are knob-like. They having the rounded heads and the narrow stalk, and they are having the taste buds. This is the schematic diagram of the fungiform papilla, and this is the H&E stain section of the fungiform papilla. And in this you can appreciate the epithelium stratified squamous and non-keratinized type of epithelium. Large number of the taste buds are present in the papilla, and these papilla are scattered among the filiform papilla. Their size is about 1.8 millimeter and height is nearly 1 millimeter. They are having 1 to several taste buds. And another important point is that you can also see these papilla on the dorsal surface of the tongue with the naked eye as the small reddish spots present. Another slide, which is H&E stain section of the fungiform papilla. You can see the one is epithelium, which is a stratified squamous non-keratinized, 2 is the core of the papilla, and 3 you can appreciate the taste buds present over here. So another diagram of the fungiform papilla, you can see the rounded tips of the fungiform papilla, non-keratinized epithelium of the fungiform papilla, lamina propria thrown into folds, into the columns, and the taste buds are also present. And this is beneath this lamina propria, you can also appreciate the submucosa as well as the skeletal muscles. Another slide, you can appreciate this is the fungiform papilla, and these all are the filiform papilla having the conical tips. These are keratinized, while the fungiform papilla is non-keratinized, and its lamina propria again showing the branching, and the taste buds are present over here. You can appreciate these taste buds over here. Beneath this lamina propria, you can also see the skeletal muscles present over here. So this is the labeling. Fungiform papilla, another very beautiful diagram of the fungiform papilla, the rounded tip, the narrow stalk, the branched core or branched lamina propria, as well as the taste buds which are present over here, and the connective tissue. These are the filiform papilla. Third type of papilla which are present on the surface of the tongue are the circumvallate papilla, which are largest of all. These are present on the near the sulcus terminalis, about 8 to 12, located in posterior region of the tongue, just next to the sulcus terminalis. They are having the deep furrow next to each papilla. These are the furrows in between these two papillas, are also called the trenches of the papillas. These epithelium stratified squamous non-keratinized, again lamina propria showing the branching, and the large number of the taste buds are present. You can also appreciate the glands which are present in the connective tissue beneath the epithelium, and in these glands are mucus type of glands called the von Ebner gland, and they empty their secretion via ducts into the trenches to clear the fluid which is present over here. So this is the section of the duct. These are also the section of the different ducts of the von Ebner gland, and this is the von Ebner gland which is present over here. Another slide, you can appreciate the circumvallate papilla. Its epithelium which is stratified squamous non-keratinized. This is number 2 is the core of the papilla from the lamina propria, and you can appreciate at number 3 these are the taste buds. Another very beautiful histological slide of the tongue. Here you can appreciate the circumvallate papilla, the filiform papilla are present, and the von Ebner glands are present. These are the trenches, and here you can appreciate the skeletal muscles which are running in different directions. Another slide at higher magnification of the circumvallate papilla, you can appreciate the epithelium, the branching of the lamina propria, and the large number of the taste buds which are present, and the also the von Ebner glands which are present over here. These are the mucus type of the gland, tubulo-alveolar in nature. Another beautiful diagram, H&E stain section of the circumvallate papilla and the von Ebner glands and the ducts of the von Ebner gland. You can also see the duct of the von Ebner gland over here. So this is another slide. You can see the foliate papilla, number 4 type of the papilla, which are the foliate papilla, which are present on the lateral edges of the tongue in the form of the parallel rows, and these foliate are finger-shaped papillas. In the straight or finger-shaped papillas, they are again having non-keratinized epithelium, the lamina propria showing the branching, and they are also having the taste buds, but location varies. These are present usually on lateral edges of the tongue and usually at a right angle to the long axis of the tongue, and their number decreases with the age. So in older individual in the section of the tongue you cannot see the foliate papillas. Another diagram through foliate papilla. These are the finger-shaped papillas. These are the trenches between the finger-shaped papilla. The lamina propria, which is thrown into folds and branching. These are the taste buds which are present. Again, mucus type of glands present, which open between the trenches of these foliate papillas. And these are the section taken through the skeletal muscles. Another slide showing the gland. So another slide, which is H&E section, foliate papilla, which are present in the form of the rows, and their epithelium, which is usually stratified squamous non-keratinized, branching of lamina propria, large number of taste buds. In between the two papilla, you can appreciate the trenches which are present beneath epithelium. You can see the loose connective tissue and moderately dense connective tissue, and the ducts which are present over here. These are the ducts of the glands. Mucous glands are the von Ebner glands which are present beneath in the submucosa. So different slides, you can appreciate all the four types of the papilla over here. These are filiform, keratinized, do not containing taste buds, having the conical tips. These are fungiform, scattered among the filiform. They have the rounded tip, narrow lumen. They are having non-keratinized epithelium, branching of lamina propria, and having the taste buds. Then the foliate papillas, these are finger shape, present in the form of the rows on lateral edges of the tongue, and these are again lined by non-keratinized epithelium and large number of taste buds, and the glands, which are the von Ebner glands, present over here. You can also see the ducts of the glands which are present, and this is the slide through larger at higher magnification. You can appreciate the taste buds. Three types of cells, as I have already mentioned. These are the neuroepithelial cells, the sustentacular cells, and the stem cells. So neuroepithelial cells and sustentacular are supporting cell extend from the base till the top, and here they possesses the microvilli to sense the different taste stimuli over here, and the other type of cells, which are stem cells, are present over here. This is the slide of the circumvallate papilla. You can appreciate the difference in shape, and also the non-keratinized type of epithelium, the branching of the lamina propria, large number of taste buds, and the von Ebner gland. So these four type of papilla, you can appreciate all of them. Most numerous, again I revise, most numerous, having conical tips, the only type of papilla which is keratinized, the only type of papilla which do not have the taste buds. Fungiform, having non-keratinized epithelium, having taste buds present in between the filiform papillas. Foliate papillas, having non-keratinized epithelium, finger-like shape, having the taste buds, having the von Ebner glands, and present on lateral edges of the tongue. Circumvallate papillas, present in the form of 8 to 12 circumvallate papilla just anterior to the sulcus terminalis. Their shape varies from that of the foliate. They are having non-keratinized epithelium and the taste buds and the von Ebner glands. So this is the higher magnification of the taste buds. You can appreciate the taste pore over here and the microvilli over here, the different types of cells which are present of the taste buds. Another slide, very beautiful slide showing the taste pore over here. You can see this taste pore. These are all different taste buds. So here we end the lecture of today's. These are the references: the histology text and atlas by Michael H. Ross, and the medical histology by the Laik Hussain Siddiq. So thank you all, dear students, for your attention for the first lecture of the histology of GIT. And next we will inshallah start with the esophagus. Till then, Allah Hafiz.